Yeah, so first of all, thank you very much to all the organizations for accepting our invite and expressing the interest and willingness to be part of today's panel discussion organized by the TESF Research IHS Bangalore. Um, the title of the panel discussion is COVID-19 pandemic and the impact on education in India. We are trying to understand the response and the interventions of the non-state organizations. So we all are extremely aware how the pandemic has significantly impacted the educational processes, the practices, and the systems at large. So the idea of the panel discussion is to understand how the non-state organizations are responding to the COVID crisis. How are they assessing the situation? What has been their COVID educational models to reach out to the marginals or the most vulnerable sections of the society? What kind of challenges they are confronting working at the forefront, largely the grassroots level experiences, be it at the community level or at the school level? Any digital mediums they are providing to reach out? And how are the organizations doing the documentation of their work? So the sharing and the discussions will be largely around these concerns. So we have the speakers for today. We have with us Anustup Nayak. He's the Director, Classroom Instructions and Practice Team from Central Square Foundation. We have Arjun Sanyal, Senior Program Manager from Aga Khan Foundation, India. We have Sayantani Gaddam, Executive Director from Ahvaan. Mihika Sharma, Senior Manager, Program Management, and Sheshadri Anandrao, State Head, Karnataka from Pratham. And we have Sreehari Ravindranath, Associate Director, Research and Impact from Dreamer Dream. He'll join in about 10 minutes. Anustup,
Sure, sure,
okay.
sure.
Yeah.
Just to give you a quick introduction, some of you may be aware of Central Square Foundation or maybe not, but I'll just give you a quick introduction. Central Square Foundation has been working largely focused on foundational learning in early grades. Our work is both with state actors, so we work with Indian states, UP, MP, Gujarat, Assam, and Delhi with Sayantani and team. We also work very closely in supporting a range of non-state organizations like the ones Sayantani works for, as an ecosystem of actors who are supporting both the state but also the affordable private school sector, the budget private school sector. And in doing this, I think COVID obviously has been a big spanner in the works. Just kind of, it's an understatement. I'll kind of start off with what you already know, and I think I sort of acknowledge the fact that this is a learning loss of unprecedented proportions. And I think while research studies done in other countries are showing that maybe children are going to fall 25% behind or 30%, those are all understatements. I would imagine, based on at least my couple of decades and whatever we are hearing from our partners, is that perhaps many children will fall a year and a half behind, and it may take again, I'm quoting very different research. It may take between 5 years to even a decade to catch up. So I think whatever we do now is a crisis of unprecedented proportions. But like the eternal optimist, I also would like to show you a couple of examples of what I think could be some good opportunities. So I'm going to start with the fact, since the first speaker, I mean, some of these that even when schools are reopening, there is an increased risk of children from disadvantaged socioeconomic centers and children going to drop out. So I'm just going to start on this kind of cautionary note that this is not over. And I'm going to obviously talk about some of the things that people are doing in the intermediate term to catch up, but I think the effort should go on. So I think if you look at one big response, which is an interesting response, which has happened, is remote learning. And before I go into, again, the case studies of what some of the things that are working, I'll give you some of the top line kind of findings from our ecosystem analysis. That one is, while technology can be a great enabler, however, there is a significant parental and teacher support needed. We can't just kind of leave it to any piece of technology and think that it is going to work. So I think that's the first kind of cautionary note. So there is an opportunity for us to kind of realize, and especially the role of the parent, because for a long time, and even the role of the teacher has come into prominence. So I kind of see that in a positive way as place that we really can't leave that out. I also need to acknowledge that high-tech remote learning, what I mean by that is very high-end apps and very high-end digital devices which are needed. They only cater to a small segment of the very, very thin slice of the student population. So what we need to be looking at is kind of the low tech, and that's kind of what I'm going to talk about next. So that's important. And the final kind of point I want to make is that what happens when the children are going to come back to school, and I'm sure the Pratham team is going to talk about that as well, because I mean we've learned a lot from them and Rukmini and others on what's going to happen. So I think how do we adapt the curriculum and the instruction going forward so that when children, as and when children return to school, we are not kind of just letting it go back to the way it was business as usual. So those are the 2 or 3 cautionary kind of points or learnings that I wanted to share. But I want to now come to slightly the positive part, that if you look at what's happening across the board, and we've done, and CSF has done some research, we're happy to share all of these findings in a much longer research document which we have created. So there's some interesting modalities or channels of learning that have become very prevalent both in India and in other developing countries. So things like radio, even the mobile apps, web-based resources, but again in a low-touch way. IVRS, which is you call somebody and get voice back. SMS, telephones, television, and even radio have all come into prominence as channels to disseminate work to children. So whether we are looking at Uttar Pradesh, doing some work in radio, the Diksha app for teachers, a lot of work done on WhatsApp and SMSs and television. So the larger point I want to make here is when we think of technology, most of us think of someone who is just using a very high-end device or a high-end application. But what matters more is not the technology. In fact, the technology in some of these are quite old technologies, but the way they are being used are very interesting. And a couple of case studies, and I'll come to the state sector, and Poonam spoke very eloquently about what's going to happen. But one of the big sectors affected by this is the affordable private school sector. 1 in 2 children, almost 1 in 2 children go to these budget private schools, and many are impacted, and the schools themselves are impacted now because parents are unable to pay the fees. And the schools are going to be not sustainable. So not only will these schools are closed now, many will close down, which is a very sad situation. In this, one of our partners, 321 Foundation, which works with these budget private schools, has created a program called CAPE, where they realized that what if we go and support teachers and parents with a resource that can go on WhatsApp. And these resources are very high quality lessons, but very simple, just kind of something bite-sized, consumable by teachers and parents, worksheets, small assessments, and they've been able to build this all out in 2-3 weeks. That's one of the interesting things. It's just some organizations have responded with an unprecedented pace of innovation. Similarly, if you look at what Language and Learning Foundation led by Dr. Dheek Chandran is doing in Haryana, one of the interesting things they're doing is what is they calling this Har Ghar School. So they're kind of leveraging a direct-to-parent intervention where grade appropriate print-rich materials for children are provided. There's kind of, again, using these IVRs and SMSs to ensure that children are being supported, parents are being nudged. And almost 12,000 children in Haryana are supported through this daily homework. Also, there are some home visits being planned to resources. And interestingly, there's a lot of engagement from students and parents, many of whom are now responding back. So this has been one of the big challenges. There's a lot of push of information, but there is no pull of response from students. So you can see that students are responding with interesting activities, and these are children in fairly disadvantaged, either rural or semi-urban communities. Again, similarly, in one of our other partners, Vikramshila in Assam, who's working with preschool children, has created some very interesting learning materials, very simple weekly calendar of activities, simple instructions, song, rhyme, stories, and both in West Bengal and Assam, they've created this calendar which kind of goes out. And one of the most interesting things is that the home has come alive with a lot of learning. These are parents in rural areas doing some very simple activities at home. And I think as a pedagogue, what has fascinated me is that how simple some of these interventions are. And it's almost flummoxing that why didn't we even think of this when there was no COVID? Just to kind of wrap it up, I think just in terms of implementation, of course, we need to enhance access. We need to get parents community more engaged. We need if and some form of remote learning is going to stay on going forward as well, because we never know what the extent of the virus is. If children come go, school shut down again, we need to maintain the momentum, and some kind of public goods and resources are going to be. And finally, I want to end with the note that we need to think very, very hard about when children are going to come back to school. What is the kind of curriculum that is going to be taught? Are we going to assess the children with a quick assessment to understand where they are actually, teach them at the right level, provide them with some kind of accelerated learning program as they catch up. So I think I'd like to end here. And the two, three messages that I want to sort of share, just to summarize: one, there's a massive learning loss, but there's also an opportunity for innovation, which we have seen, but it is not enough. We cannot just stop here and be happy with what we have done. We really have to think about the next even 2 to 3 years, and especially the worst affected will be the children in the lowest grades, because what we're seeing is a disproportionate focus on children in the higher grades, which is good. I mean, they're also children there, but I think the weakest link is the children in the lower grades. So I just like to stop here and take your comments if there is anything.
Thanks very much. We can now move on to the next speaker. Do we have
Yes, so we now have Arjun. Yes, Arjun. If you
Arjun from Aga Khan?
Yes.
Yes.
Yeah.
Arjun, please. Yes.
Right. So hi, I'm Arjun from Aga Khan Foundation. I work with the education team, but we have a portfolio covering early childhood development all the way to youth and adolescent and empowerment. So pretty much working with 0 to 20s. Very briefly about the organization. We are part of a larger network. Why I'm mentioning this is Aga Khan Foundation is one of the entities working on social development, but we also have health services. So we have Aga Khan Health Services as a hospital in Bombay, which is a COVID, it was a designated COVID hospital as well, the Prince Ali Khan Hospital. Aga Khan Education Services is another entity within the network, which has its own preschools and schools in Gujarat, Telangana, and Maharashtra. So they had a very different response to what we've had because we work with government. And then there's the Aga Khan Academy, which is an IB school in Hyderabad. There is a bunch of academies, high-end, with very different segment of population. So there are different agencies working on education. I'm just going to talk about what we have done in the different states. So we worked on multiple things. So education and early childhood development are just part of what we do. We have done a lot of COVID response, especially on WASH, around hygiene, around ensuring food security, because the main challenge in the first part of the lockdown was this: how do we build awareness around COVID, response in terms of WASH, response in terms of getting farmers linked to markets and enabling them to sell their produce. I think that was something which we focused a lot on. But I'll talk more about the education response. But just to give you a brief background about that, we work mostly in Uttar Pradesh, Bihar, Madhya Pradesh, Gujarat, and Telangana. I'm going to focus on a few of these states, UP and Bihar in particular. Initially, how we learned a lot was initially we have our own teams in UP and Bihar. We implement directly. So we went to the community through telephone surveys in mid-April itself to find out very quickly what were the challenges. So in education, one of the challenges was that the daily routine was affected. Very few families said the children were studying. Very few families said that they were engaging with children, though they were at home. And I think the parent engagement was something that we focused on. A lot of parents were concerned that bachche bhul jayenge. If it's okay, I'll mix Hindi and English. And there was some instances of physical punishment because caregivers were under a lot of stress. around that time, loss of livelihoods, pata nahi kya hone wala hai. So physical punishment as a way of managing child behavior did come up in some of the conversations. In UP and Bihar compared to say Gujarat or Maharashtra, the main challenge was that WhatsApp as a medium did not have as much reach. Most people had low-cost Geo phones. Even the ones who had WhatsApp, they did not have Android devices, so low res. And also there was another challenge of people not recharging their phones. So sending videos, we very quickly learned through our own mistakes that we can send whatever we want, but people can't view them because they're not recharging. So that was something that clicked us. So I'll talk in two things. In early childhood development, we had an existing pilot. We repurposed very quickly whatever we had, and we said that, okay, 20-30%, 20-30% can receive WhatsApp. Let's repurpose the material. Let's work with the Anganwadi workers, train them so that they can reach out to the remaining 70%. So we tried to reach out directly to parents and through Anganwadi workers, but also trained Anganwadi workers on certain things and simple things around tips, parenting tips about ensuring their child's routine, doing simple activities at home, nothing very difficult. And we trained Anganwadi workers in Bihar a lot, their supervisors, using old school techniques. They could not connect, so our team members did con calls in groups of 5 so that the Anganwadi workers understand and then they can pass on messages to parents as well. We realized an opportunity in this crisis that fathers were at home. So we also looked at promoting the father's role in childcare and early childhood development and developed some posters just to ensure the father's role. And like Anustup also pointed out, we've had some very good responses, interesting responses of families and caregivers responding to the activities very positively. On another track, we have this large program called Schools 2030, which was supposed to start in 2020, a 10-year program that we are starting in Bihar, and where we are employing a human-centered design approach to design solutions. So we learned from parents, a few things like people were doing Zoom classes, and parents said that, we observed a music class, and we're talking about a range of parents, not just UP, Bihar and low income, but a range of parents we interviewed and found out, they observed a music class where the teacher was singing and the children were on mute. On the other end, there were, and these were woke parents, very well educated, who said that, conventional schools plus online mode is a recipe for disaster. So the way you have to think is going to be very different. On the other hand, parents in rural communities, low-income families, a lot of things they said were around, we don't have ideas how to engage. If you can give us ideas, we'll do that. We looked at how parents and schools are interacting. So schools were sending, and these are private schools also. In Delhi also, I tried figuring out how they are responding to learn from them. But this is what was happening. Worksheets were getting scanned from textbooks. They're not engaging with the child. YouTube links, people are sending. The teachers are sending, but they're not working. They're not clickable. Parents are not able to download. The media file is missing. It's one-way information. So we learned a lot. Then we thought that let's make these WhatsApp posters similar to ECD. And the WhatsApp posters are very, as you can see, very image heavy. Very little text, looking at what are the simple activities people can do with resources at home. Even parents with no literacy, can they understand simple images? And this we did for language, maths, and extra, others, EVS, extracurriculars, play, etc. And this became very effective because people could see. And we also looked at nuance. For example, the initial design had white text on colored background. On a low-cost Geo device, we learned that that is just not visible. So how do we look at the design of the poster that it is really accessible? So it became big, bold, black text on a simple background. And we looked at the limitation. The file size is less than 1 MB. Look at text, look at resolution of the devices. So we looked at real detail. Teachers in Bihar, about 255 WhatsApp groups have been formed by teachers. We work with the government of Bihar as well in 500 plus schools. So the teachers started sharing, they made groups The CRCs encourage teachers. The CRCs, our team work with CRCs to train teachers to start WhatsApp groups, to create WhatsApp groups ki banta kaise hai, and encouraging them to share, follow up with parents who are not able to access, and also sharing. And you can see some examples of how people are sharing on the WhatsApp group. But we learned again that, again, this thing, that this can reach only 20-30% of this children. Like Anustup also said, that we are reaching still. We're reaching more, but not a lot of children in UP and Bihar. This is more effective probably in Gujarat for us. So then we said, can we do something that they can continue even without internet? So we did a lot of brainstorming. We did a lot of online brainstorming across team members, generated a lot of ideas, and we came up with a very, very simple idea, which is like Flinto Box. If you've seen Flinto Box and a Magic Crate in the US, there's KiwiCo, very high cost, very good materials. But we thought, can we do a learning at home kit? And we said, let's put our posters, the ones in WhatsApp printout, and give activities related to that. Can we just, if we're talking about picture cards, a story batana, so can we give the picture card? If we are saying origami, can we give some colored thing? Just to motivate them a little further. They use home materials, but thoda additional support kya ho sakta hai? Parents, we prototyped this, did not implement, we prototyped this. Why I'm saying that the approach was prototype, learn, and the parents gave some feedback. They seemed happy with low cost. They didn't care that it was not fancy. They gave feedback that it should not be very expensive. And then we figured out through a lot of feedback that these are the components of a solution, that there should be a box, it should be low cost, it should be sent every month. There should be people, either community volunteers or teachers, who follow up with parents and children. And maybe this can be supplemented with community level resources. And again, like Anustup also mentioned, can we then supplement through IVRS or other mediums? So this is something that we came up with. Last thing I'd like to say, that right now, there is one concern that parents are gradually going back to work, but schools are closed. And children in rural areas may be on their own. So that's a point of concern for us, that a lot of parents who were at home are no longer at home, and schools are still closed, Anganwadis are still closed, and we need to also think of solutions for states where this may happen. Thank you.
Thanks very much, Arjun. That gave us an idea exactly what kind of questions you've been grappling with.
Sayantani will.
So Ahvaan Trust, Central Square Foundation is one of our strategic partners. And we have been working in the early childhood space. And we are a young private trust which was started in 2010. And in 2014, we actually went into a learning mode. And we decided to take a bottom-up approach to learning. And that is, we nosedived, since we were based out of Delhi, into the Delhi classrooms. And I'll little bit go, since we are a group of people who've come from the education domain, and many of us are researchers and learners also in our profession. So I'll just sort of start the story and come to the COVID response little later. It's about creating learning environments, and that is what we found, that for Ahvaan Trust, this was a very important imperative to go into those classrooms. And what we noticed in these classrooms is that many of the classrooms were just like this. They were 4 walls, a group of students hanging around, possibly a teacher who created, I noticed in one of your things that people are getting scolded. So similarly, even in the schools, this is what was continuing to happen. And so what Ahvaan started to do was that we wanted to look at learning. And if we really want to look at learning at the very fundamental stage, then we start from the very basics of the Delos pillars of learning. And this hasn't changed, whether it is for the self, the family, or the community, or the global citizen. So taking these principles forward, and the fact that for the 21st century, to have a holistic approach to learning, we looked at all the aspects of learning right at the early childhood level, because this is when the time, as has been made clear, and it is only now in the NEP 2020 where this is getting addressed very clearly as the foundational learning necessity. So therefore, with this kind of a bent of mind, Ahvaan went into implementation mode and went into the classrooms. So we therefore looked at that, how do we make the child who has finally accessed a learning environment, what does it take for the child to stay and learn in that environment? So we found that in this, all of these things are what Ahvaan would have to address in any early childhood classroom. So these would include the classroom resources, in-service training, and a support to the teacher post the training, have even if you are school-oriented, have a parent engagement with that so that the parent and the school start to talk to each other, and then round off by coming back to the pre-service teacher training. So what we found is that the agency for the teacher is a very, very important aspect of early childhood development. So therefore, the way we began our work was with curriculums, in-service training, coaching, mentoring. And we learned and tested our things in certain lab schools where we experimented and assessed children on all of these fronts as to what the outcomes were on their learning. While we went about this way, we did create a change with the post-intervention. So today's Delhi classrooms, this is from one of our classrooms that we are engaged with in Delhi. The picture has changed a lot, as one can see. And therefore, we feel that this is the best way forward, because with COVID or without COVID, we still have to give the children a lot of engagement. Children at this age will not be able to navigate through any kind of technological interface without human support, be it a caregiver or be it a teacher. So therefore, I'll focus more on this slide. We are in two states just now, Delhi and Tripura, and during COVID-19, we were basically looking at two aspects. And one is that giving a lot of teaching learning materials, and on the other side, giving a lot of training side by side to the teachers. I'm happy to say that in Tripura, we have been able to submit several curriculums, graded curriculums. Tripura is poised at this moment to initiate pre-primary schooling in the government schools. And along with that, we have also started an online training. We said that if early childhood development cannot be fully addressed by home, especially by grassroots level agencies like ours, which are finding it very difficult to overnight change, then we should prepare the ecosystem to be prepared once the schools reopen, better prepared. So therefore, we are focusing a lot on the building of the curriculum and the teacher training so that the students are better prepared once. We accept that there will be learning loss. We are also trying, like my colleague from Aga Khan Foundation has shared, for Delhi, we have started sharing worksheets, student workbooks and worksheets, as we have shown over here. We have created certain videos for students, which we posted just through our Facebook, because we realized that not everybody has the access to smartphones, etc., especially in the government school context, and more so in states like Tripura. In Delhi, the WhatsApp existence of smartphones is a little higher. So therefore, we thought that for agencies like ours, which is working right inside the classrooms along with the teachers, the left-hand part of creating materials and the right-hand part of supporting online training of the teachers so that they are better prepared to carry on the curriculum is our response to COVID during these times, without trying to completely rejig all our offerings into a new normal. Because as far as early childhood is concerned, and this I have taken out of a US, they put an action force together for early childhood educators in the US, and I thought that's a brilliant report that they have on the use of technology for early childhood, both for teachers as well as for students. And so the whole discourse, the narrative on technology is very divided. As far as it is targeted on the adult or the teachers, it can have quite a good impact. But children to be uh, opened up and to expose to passive kind of learning, because mostly there are children who are coming who are not from learning environments. They do not have enriched learning environments in their neighborhoods. It gets very, very difficult to have the child pick up even the skill. Let us forget about the knowledge and the values bit for the bit, but even if it is a matter of the skill, they may pick up something wrong. Actually, just 15 minutes before this call, we just received a call from the Directorate of Education saying that they have finally accepted some of our worksheets to go in for kindergarten and class 1 for English and Hindi subjects to the students and parents. While they have been made colorful and we are trying to teach them a few things, we ourselves are in a lot of doubt as to how much of it can be really achieved. The learning loss is going to be heavy. And also, these activities and this intermittent period cannot be assessed on any scale, be it parent competencies or children competencies or any kind of teacher support that the teachers are trying to extend. We have a WhatsApp group of teachers with the schools that we are engaged, and those teachers are trying their level best. They take the worksheets, they make videos out of themselves so that their voices are heard by the parents, and they try to explain the activity out to the parents for the children to learn better. But we still, I think, have a long way to go. As early childhood educators and foundational literacy and numeracy, I think we still need a much more cohesive effort in addressing this need. I don't think we have fully understood the problem. And also there is a lot of tactile support that is needed, which technology unfortunately cannot provide at this point. So thank you. And it has been wonderful listening to both Anustup and Arjun before me. And I'm really looking forward to the other presenters as well. Thank you.
Thanks very much, Sayantani. So we can now move on to the next presenter. Is that from Pratham?
Yes, so we have Mihika and Sheshadri from Pratham.
Very, very good evening, everyone. Thank you for giving us the opportunity to share our work here today. Like everyone else did, I just take a moment to give a quick background on Pratham. Pratham is a non-profit organization working in the education space. Our work spans multiple age segments from age 3 to age 14. So our work includes early childhood education, foundational learning programs for children in primary grades, programs for children in upper primary grades, which focus on slightly more advanced competencies, introduces science and other advanced math concepts as well. And running across all of this is a thread of digital learning to aid the entire process, to provide children communities with access to a wider range of learning content, and to strengthen our social structures. We are present in over 20 states and union territories, and our interventions are largely conducted in two ways. Either directly, which means that a Pratham team member directly works with children and communities, or in partnership with government systems, under which we try and integrate our methods with the government's existing machinery. While we work directly, we reach about 5,000 villages and communities, and our indirect work is active with 15 state governments and reaches around 5 million children each year. Before we jump into what we were doing pre-COVID, we thought it'd be important to just spend a minute on what was our approach before the pandemic. And so there were a few key principles that guided our work, which actually proved to be immensely useful when we pivoted our strategy post-COVID. So the first is that most of our work used local resources. They were extremely low cost but high impact. We used simple methods and processes. The ideology was that any person in a rural area, in an urban area, should be able to understand what Pratham does and be able to deliver it in their own community. We encouraged strong community involvement. We believe in not only influencing community actors, but meaningfully engaging them in what we do. And finally, there was a very strong focus on measurement and monitoring and assessment of what we do. And so as we worked, if I take two key age groups in which Pratham's intervention was underway, the early years and the primary age segments, our approach was on foundational learning. While in the early years, we worked to build these foundations in an age and stage appropriate manner. In primary grades, we adopted a more catch-up approach because children were already behind where they should be in terms of basic reading and math. And so we adopted a more accelerated approach that we call learning camps, or teaching at the right level, as it is known as, for primary grades. We worked across different spaces that the child was in. So we worked both in the school or in the Anganwadi. We worked in the neighborhood, or what we call the mohalla, through groups. For younger children, these were mothers groups. For older children, it was the children themselves who would, by hamlet or by neighborhood, gather in groups of 4 to 5 children each and spend time together post school hours, and Pratham would periodically introduce them to learning material, activities, resources, and so on and so forth. And then there were community events happening. What all of this did was that it helped us identify anchors in the community. While in the early years age group, these were mothers, Anganwadi workers, other volunteers, adolescent girls, young women, etc. In the primary grades, these were village youth, government teachers, and so on. And of course, running across all of this was a deep investment in digital content and technology. So over the years, we have developed content in 12 different languages, across age groups, across domains. So we have content not only for language and math, but also for art, music, theater, and so on and so forth. And it was the community networks that we had, when combined with the repository of digital content that we had, that actually helped us very quickly pivot our efforts in a post-COVID scenario. So, I mean, this has been talked about in all the previous presentations, so I won't spend too much time here. But some of the key challenges that we kind of saw the minute schools were shut, many learners were out of school. They did not have access to any kind of learning resources. There was no movement possible, so we were not able to physically visit our communities. There were high levels of anxiety and stress in households, and we wanted to keep in touch with our communities to understand whether they are doing well in this kind of a situation. There was a lack of awareness about health and sanitation, which added to the uncertainty and stress levels in households. And there was an overall lack of preparedness for remote learning, be it from the schools or be it in the local community. And so when Pratham developed its solution, it considered 5 different factors. One, what is the content that can be delivered easily in a remote manner? How do we leverage the community networks that we have established over the years, be it the mothers, be it the local volunteers? How do we work with them in order to be able to reach children? How do we capture what we are doing? How do we learn from this period? And how do we factor this in as we devise our strategy moving ahead? How do we collaborate with new partners as well as with the government? And finally, how do we build our own capacity? Because Pratham comprises 7,000 people who largely work on the field, and we suddenly had to move to a mode which was entirely remote. So keeping all of this in mind, our strategy, which we called the Corona Thodi Masti Thodi Padhai campaign, which was a spin on the word, a fun spin on the word Corona, incorporated 4 key elements. One was that there was active community participation. So we involved parents, we involved volunteers, we involved children, and we did this across 11,000 communities across 21 states where Pratham had some presence. And it was through these parents and volunteers that we reached our children. We developed content that could be accessed through mobile phones, because that is the one piece of technology that we generally find. Of course, smartphones is very limited in penetration, as we all know. And so we also had to devise a way to work with regular phones. So not only did we create WhatsApp-based content that could be sent out through smartphones, we almost overnight developed in parallel a stream of SMS content, which could be sent out to regular phones. And I'll talk about the process of how the SMS content went out in a bit. We used the existing digital content that we had, and we created new content in parallel, and we collaborated with multiple governments and nonprofit organizations to expand the scale of the work. So this is essentially the flow that we followed. We had a central content team that created the guidelines for SMS and WhatsApp communication. These were translated by the state teams and were available in different languages. Then the local Pratham person in the area would send these messages to the parents or to the community volunteers, whoever was our anchor in that village, whoever's contact information we had in the village. The Pratham person shared the message with them. When an SMS message was sent, there was a very active focus on also doing follow-up conversations with them, because WhatsApp, while being a lot more dynamic and interactive medium to interact with parents, there's often a video. Parents can open and see what the activity is and do it themselves. But with the SMS, it took time for us to get that level of engagement. And so there was a lot of focus on doing follow-up phone calls wherever SMS messages were going out. Parents would conduct these activities. At the same time, there was a very strong focus on ensuring that they share back something with us. So we didn't want to just send out the messages. We wanted to make sure we were hearing back. And so we encouraged them to send us photos, videos of what they're doing, because that was what was helping us get a glimpse on how effective these activities are on ground. And finally, the Pratham person conducts follow-up phone calls to not only understand what are the challenges that are happening on the ground, but also take feedback on the activities such that we could constantly make our content more engaging and more relevant to the parents and what they wanted. So this is just the age groups that our content was available in. For early years, our content was designed such that there was parent and child interaction kind of designed into the message. So that helped us get mothers, fathers, and other family members also a lot more involved in our work. For older children, it was more project-based learning activities. So there was academic content as well as more fun content around art, music, and theater. And we also worked to create this cadre of youth and parent leaders who could, moving forward, help us gradually initiate some activities because we were uncertain when we would be able to go back into the community. Just some visual examples. So this is an example of a message that we sent out. It was about how plants grow, which was sent out to the young children in our communities. And in return, we got back some of these photos from the village about volunteers and parents doing these activities with their children. This is an interesting example of SMS messages. So the biggest challenge was to kind of make a whole activity, compress it into a 160 character limit and send it out and do this across languages. So we did send out these messages. Initially, of course, we did not get photos and videos back. But with time, we realized that parents were actually borrowing their neighbor's phone to send us back photos and videos because they wanted to share what was happening. So we also received some photos and videos back on the different kind of SMS activities that went out. So for example, this is an activity around Matar Chilna, and we got back these kind of photos from the community. I have a video, so I'll choose one that is relatively short in duration, just so that I hope it's audible.
ಹಿಂದಿನ ಚಕ್ರದಲ್ಲಿ 36 ಕಡ್ಡಿಗಳಿವೆ.
So this was just an example. We've compiled a lot of the responses that we've got across age groups in this kind of a format, and we'd be happy to share these videos Yeah. So I just take a moment to talk about what were some of our key learnings through this entire period. One was that the content that was most effective was the one that was easy and fun, and that parents could simply understand, and which made use of materials that were very easily available in the household. If it was very complicated material required, we did not get a very good response. So it was very important that we kept our messages simple, crisp, and fun for parents and children to engage. Communities and pre-existing social structures. We had mothers groups, we had engagement with Anganwadi workers. Those were areas where we got the most kind of response, because there we kind of had our representatives who were kind of ensuring that, people are doing the activities, reporting back to us. And they were really people who helped us gain more traction in the local areas. So the pre-existing social structures that we had were immensely useful. And the third and perhaps most important is that the human connect was very important in this time. As we were sending out the messages, we saw the importance of making sure we are following up through follow-up phone calls, being in touch with them. If you're not getting a response from somebody, trying to get in touch with them through another source, because that really helped translate the messages into action. This just quickly talks about how we've collaborated with other partners, other governments through various forms, not just WhatsApp and SMS, but IVRS, radio, TV, and content portals as well. And as we move ahead, I'll just take 30 more seconds. As we move ahead, we are trying to now, as mobility is gradually improving, even though schools are still closed in some areas which are not high risk in terms of COVID, there is the opportunity to kind of begin reinstituting some of these social structures that we had. And so some things that we are starting at a mohalla level include volunteer-led classes. So we are remotely working with some volunteers on how they can do some simple activities with children in small groups, 4 to 5 groups, while maintaining, of course, all necessary social distancing protocol. For young children, this is mothers groups. And because we have kind of created this huge cadre of youth volunteers, we're now also trying to think of how to create a two-way system where, because the volunteers are engaging with children, in return, they are getting access to a new course or a new learning opportunity that could in turn enhance their own personal professional development. So that's a very interesting phase we are entering into right now, and we are piloting that. And of course, as we move ahead, we want to continue doing all these activities, but as schools reopen, we want to support the school system in this period, because even once schools reopen, it may not be as simple to get children back to school because of the fears and uncertainties that remain in parents' minds, in children's minds. So supporting that transition, and once they're in school, of course, working on helping children catch up, because the learning loss in this period, as people have said already, would have been immense, much more than what we would have seen at the beginning of any other academic year. And so helping schools implement catch-up programs, doing it in the community, etc., is going to be a very important focus area. I'll stop. Sheshadri sir, if you want to add anything here, please. I just rushed through some parts. But
want to reinforce what Mihika has just shared with you regarding what we should be doing as we go forward if the school reopens. And I think there is a message to the government in this. So we have to consolidate rather than running for the curriculum. So as soon as the school reopens, I think every one of us will be tempted to run for the curriculum. We should stop that. While the top 50% may not be impacted much, the bottom 50% will be more pronounced, will have a more pronounced impact due to the loss of learning. I think Mihika has already pointed out that. And a refresher course, a column-specific intervention is needed more. And I think we can build on what we have learned so far.
Thank you very much. We'll get back with questions, of course. We have the last presentation, I think. Yes. So let's have that. Is that Sreehari?
Yes, Sreehari
from Dream a Dream.
So just about a Dream a Dream. So we have been working with children from a disadvantaged or from the marginalized community for the last 20 years. Unlike on the academic side, we actually work on building life skills of kids coming from this adversity or from marginalized community. So we have around 4 programs. One we call it as the After School Life Skills program. Second is the Career Connect program. This is basically for the young adults or youth. Third one is basically for teachers, and we also have our signature program from the beginning itself on mentoring. So volunteering basis, like people from IT industry, so they actually mentor some of our kids from some of these communities. So these were our programs. And when COVID stuck, we were all really puzzled to know, what exactly we will also do. We were also clueless in terms of how exactly we can take some of our programs, because in our after school, let's say it was football as the medium. So football as the medium, arts were some of the mediums, computer skills were some of the other mediums for things like that. So whole program which was actually running in centers or in schools, and we got really into a difficult situation. So we took that moment basically to as a more for strategic planning, because we haven't moved to any digital platforms. Nothing have been done in terms of our online initiatives. Nothing much on that line. So we thought it's also a moment for us to make sure how we will rebuild some of our strategic plans and how some of our programs, how we were actually executing before. One thing I think what we have done basically, so we were reflecting upon why kids were actually coming for our program. So one of the basic reasons were they have a lot of issues in their community. or they do have issues to stay in their families because they are coming from a broken family and things like that. So these centers and what we were doing were actually psychologically and physically a safe space for them. And our facilitators, our trainers were basically a strong, plays a very strong adult in their life. So I think three core things that we have done is basically we wanted to know, we reached out to, so we work with 10,000 kids every year. So we reached out to all these kids to understand, what kind of needs and support they actually need at the time of lockdown and things like that. So we extensively reached out to all the kids to understand whether they need some support in terms of ration kits or medical emergencies that they're going through, any other needs that they wanted to know, things like that. So that was one of the, we call it as the COVID response survey, to basically understand what was going on with the kids. So that was based on that. One thing we understood is there is a lot of confusion in terms of how schools are going to be, how exams are going to be, things like that. So they were really worried in terms of what will happen to them. So we created a task force for psychosocial emotional support. So our facilitators will reach out to them in terms of supports. And in case if you feel that they are not actually if they do have high level of anxiety or they are actually going through some kind of confusions, they will be referred to the team of expert constituting psychologists, psychiatrists, social workers. So they will talk to them. So that was one of the initial thing that we have done, let's say for 2 months. Meanwhile, we understood this COVID is also going to be prolonged and school closure is going to be something that it's very uncertain about what's going to happen. So that's where we did our second survey to understand, let's say the available mediums of technology, how well we can actually integrate or shift to some of our works to these technology platforms. And we did a survey to understand the gap. And surprisingly, what we understood is it's in Bangalore, or some of the places in Karnataka. So they had at least 88 to 90% of the kids do have a smartphone available. It was quite surprising for us, we delayed a little bit to reach out, thinking the national data which are available where kids do not have much technology, a smartphone or things like that. So once we understood they have a smartphone where they do have a WhatsApp available at least, we started sharing materials, so short materials in terms of connecting with them, reaching out small groups, or one facilitator will have around 20 kids with them. And they started, very gradually, we started some of the interactions basically. Unlike as our whole program is not focused on academic or teaching maths and science, it's all about building life skills and so our whole objective is we shifted in terms of building resilience in children. So we started our reintegration program. That's basically connecting with them, giving them emotional support, talking to them every day, some kind of small activities they could actually do through WhatsApp and things like that. And gradually we wanted to shift this WhatsApp conversation to a Zoom. And meanwhile, our facilitators were working with small group of children. So Zoom were installed. Some came in, some cannot be available and things like that. And meanwhile, one process parallelly happening is none of our programs were prepared to actually go online. So it was all art-based and creative approaches. So a parallel team were working in terms of how to tweak some of our programs into online versions of it. So we started with that activities, and then gradually, the facilitators started interacting. They do have a time schedule every day, let's say for a 45-minute session where kids will come online. Not mandatory that, to be on Zoom. In case, we track these kids, if how many were able to come online on a Zoom call. If not, we track them and see, how many we were able to engage on WhatsApp. And if that's not even possible, we track them in terms of talking, every day the teacher or the facilitator will talk to them and figure out what's happening. And the research team, I basically head the research team. So we also did a survey on school readiness, how schools are ready and prepared to understand, because the majority of the schools that we work with is basically the government schools and low-cost private schools, and they doesn't have any clue what to do with them. So we really wanted to understand what school teachers are going through. And there is also a pressure from the national media, for example, they all have a fear that, they also have to start something online, but they don't have any clue, like, what to start with, like, things like that. So we started telling them, like, okay, fine, reach out to students at least, because many of these kids may have gone back to their remote locations and villages. Reach out to them and see whether you are able to connect with them, and say that you are able, like, the teacher is always there, the school is there, so we can actually support them. So some kind of connectedness that we were actually building. So that was other work which was parallel going on. Right now, I'll say, like, we've been fully prepared in terms of the approaches, like remote learning, virtual learning, blended learning were very new for all of us. But now, like last 2 months, I'll say all programs have been, let's say, into a digital platform where we have a blended learning approach where some of our content for the teachers go online. We have regular Zoom calls with the teachers. Our groups become smaller in numbers so that we have attention to them and things. Some of the other computer programs, we also approach some of the organization which were able to help us in terms of providing free coding or computer skills, basic computer skills based on their app and things like that. So that was another approach where we reached out to young adults who is sitting idly at home, and encourage them to be part of this program and explore coding, explore advanced Excel, things like that. That was actually boosting a lot of confidence in them and esteem in them. Now we have a fixed routine. The facilitator will be reaching out at different slot of time to different set of students. Regular calls with these students also happening. The mentoring program, which were very it was one of our program which was not really the thrust area, but we expanded the mentoring programs because many IT organizations like Dell, HP, from these organizations were very happy to engage their employees as part of the mentoring program. And another company helped us in terms of building a mentoring app where the mentee and the mentor can get connected. So gradually, I'll say, like, part and parcel of our work every day involves, now it's about how online classes will happen, how Zoom call will happen, and it's become quite normal for us. And some of our centers started operating from last week. Based on social distancing and things like that, some of our centers started working where students can come. And because one thing as Dream a Dream has always been instrumental is like providing that safe space for them. They can come, interact, talk about anything that they wanted, things which will help them to clarify or give some directions to them. So we are continuing with that program, and regular, let's say, COVID response survey being done to understand. Initially, like, they were not at all worried in terms of, school got closed, and it's a happy time for them. They really was not really cared about unlike how much we were worried of what happens if the schools are closed for a long time. But they were not much worried about it. But we've seen a mixed response. The students were very worried about when is my 10th standard exam going to happen. But there are other students who merely pass the exams, feel like, it's good that, schools are not opened. Ration kit distribution, medical supplies, things like that. That was also a big initiative happened parallelly. As we decided as an organization about giving a pause and reimagining what's actually happening and some of the systemic change we required, we launched a What If campaign. So we invited people to think, what if we have a chance to reimagining education? So many organizations were part of it. Many individuals and teachers started thinking in line of how reimagining education can happen. And surprisingly, something I noticed in terms of programs team actually took this one as an initiative where how a personal change can be brought in, how as an individual, how I can make some changes in the community. So they invited students and young adults basically to think in terms of what kind of change they can bring in the society. And some of our case studies are like some of these thought process really help them to think aloud and make some actions in the society. So there was one case where his father was basically a tailor. So he decided, like, why can't I make some kits the PPT kits. So he started making those kits and started selling it. And some of the kids who were good in terms of stitching and embroidery, things like that, they started making masks, beautiful masks that they started selling across. So some of these changes we started seeing in our kids. I think that's the whole spectrum of what we are actually doing at this point of time.
Thank you very much, Sreehari. Well, it's almost 8:25.
Yeah,
I
we
think,
can continue, but yeah.
thank you so much for actually staying on that long and for all the sharings that you have been able to give us. I think it's helped us to develop an understanding of what has been tried, what your questions have been, what are the challenges that of course still remain. It's a huge, huge challenge, I think, for us, specifically in the kind of inequitous context that we are in. So thanks very much, all of you.
Thank you.